Hey guys, welcome to A Little Help for Our Friends, the podcast for people with loved ones struggling with mental health. Welcome back, little helpers. Oh my God, are we excited for this topic? And that is now the third week in a row I've said that, but for real this time because we're going to be talking about sex. We love talking about sex, and Kibby and I kind of delve into this topic a little bit, like we wade into it, but today we have clinical psychologist, high conflict couples therapist, and a sex certified sex therapist, Dr. Marina Rosenthal. She was here a few weeks ago. You loved her. I got many messages about how great that episode was. So, welcome back, Marina, and thanks for talking to us about sex today.
I'm so excited.
This is your favorite topic we
I
hear?
would say so. Yeah, it's my favorite topic. And um, I just really love reminding everybody that sex is a part of life, sexuality is a part of life, and let's make sure we actually talk about it.
So, everything I know about sex therapy it's not even sex therapy, it's just Esther Perel. So, is sex therapy this fundamentally different thing from talk therapy? Like, what exactly differentiates it?
Yeah, that's such a good question. So sex therapy, that was the question I had when I started sex therapy training and supervision, actually, was like, what are the magic sex therapy interventions that I can learn and deliver? And there definitely are some. For the most part, sex therapy is more about a way of thinking about sexuality. And then there's interventions that go along with that. There's certainly education about, physiology and sexual response and kind of like the facts of anatomy and how sex works, how desire works, that is part of being a sex therapist or receiving sex therapy. But I think more importantly, when you work with a sex therapist, what you're hopefully getting is somebody who is willing to look at sex from a lot of different angles, who sees sex as important as part of, humans' identity, whatever your relationship to sex is, that it matters, that you deserve pleasure, that pleasure is an important part of life, kind of like a human right if it's something that you want. There's a way of thinking about sex that I would say is the overarching thing that makes sex therapy different from regular therapy. And sex therapy certainly could be very much like talk therapy. It's often somewhat behavioral with some exercises to try, some things to actually apply into your sex life. But sometimes it's very similar to trauma therapy, or sometimes it's very similar to other forms of therapy. So it can kind of look at a lot of different ways, and it's more a philosophical frame that the therapist comes in with.
That's awesome. What are the typical problems that people come to you for? What is like the most common issue that people are asking help with?
Yeah, well, so issues that would fall under sex therapy, kind of just starting there, like broadly, there's sexual function issues that sex therapists can help with. So that's things like erectile dysfunction or premature ejaculation, pain during sex of any kind. Those are all things that, you can certainly go to a medical provider for, but you can also receive support from a sex therapist, particularly after you've seen a medical provider who's kind of ruled out that there's something else going on or wants to coordinate care. In particular, like pelvic floor physical therapists are really great to pair up with your sex therapist if you're having pain during sex, for example. So function issues, like things are not going the way I want them to. My body is not, quote unquote, performing the way I want it to. Now, part of sex therapy is often reframing the way we think about sexual performance and having more flexible and expansive options available for what sex can be and what pleasure can look like. So that might be part of it as well. I would say the most common sex therapy concern that I get as a couples therapist is infidelity repair. But other common ones include desire discrepancies, where one partner has or not even much, a different desire amount of sex or type of sex, and the couple wants to work through that. Increasingly working with folks around non-monogamy and how they structure their relationships. Whether one person uses pornography and the other person is uncomfortable with that, and how they're navigating that in their relationship, kink, all kinds of things really. It's very expansive.
I'm trying to think of where to go next because I'm sort of buzzing with all sorts of things. I guess one thing I'm wondering about is how much of what you see is a just like it's actually a problem they're having in the bedroom versus what they think might be a problem. So like my genitalia isn't normal or my performance isn't normal, or like when you were saying expanding flexibility around what sex can mean, I would think a lot of people would balk at that in part because there's this belief like if we're not having penis and vagina sex, then there's something wrong with our relationship, something wrong with our sex life. That's not real sex. So just a lot of kind of societal beliefs coming in.
Yeah, I mean, that's, I would say, in many ways, a cross presenting issue. The most common sex therapy intervention is kind of like normalizing that sex can mean a lot of different things and helping people see their own sex lives more expansively. And that's a data-driven approach. The research shows that couples who continue to have sex later in their relationships, like as they get older, have more expansive sex. And this makes total sense, right? Like nobody continues to, again, quote unquote, perform exactly the same way decades at a time. Illness, pregnancies, menopause, all kinds of things can change the way your body behaves. And so having a flexible way to approach intimacy is so helpful. Something I'll often say to couples who are getting really stuck on this is like, okay, like, so let's say that it's all or nothing, right? You can have your penis and vagina sex. Again, that's assuming a heterosexual couple, but you can have that or nothing. That's one option. Or you could have that, or you could have 25 other things. Like maybe the answer for your partner is no on the penis and vagina sex one night. Is it really for you? Like, then I want nothing. Is that a better option than, well, let's cuddle naked, or, let's make out and build tension for tomorrow night when I think I'm going to be more available? Really anything. There could be a very wide menu of sexual options. And the more options a couple has, the more likely they are to actually tap into those options and be sexual with each other.
So interesting. What do you think people's most common misconceptions are? Because like I like that you're talking about the different options. Are there certain ways that people come in thinking sex is, or like get wrong?
Well, I think people are often really worried about sexual compatibility in terms of
Hmm.
whether you and your partner match up with how much sex you want and the type of sex you want. And definitely life is a little simpler if you and your partner are just like a perfect Venn diagram that overlaps and looks like one circle. Like that might be simpler. But most people aren't going to have that, at least not all the time. You might have that perfect overlap during some seasons, like maybe when you were first dating, you were perfect circles overlapping each other. And now that, you have children, you're not, or now that you're in a really busy season at work, you're not. And so helping people see differences in terms of desire with a little bit less fear is a big part of my role. Like, actually, it's okay if your partner wants to have sex more than you. Like, this is a workable, normal difference. We don't need to be in a panic about it, especially if you can talk about it and you can acknowledge that desire and you have pathways for personal pleasure. I think that's really important, right? Like, your partner is not going to fulfill every single sexual urge, need that you have. So continuing, if there's a desire discrepancy, continuing to have a way to engage in pleasure by yourself can be really important. And just not seeing it as such like a relationship deal breaker. Like, oh no, you don't want to have sex 3 times a week. And I want to have sex 3 times a week and you want to have sex 2 times a week. That's a terrible thing. And we can't make it work. Like, no, it's really not that binary.
I feel like in a long-term relationship, I've always dreaded the time when I would stop wanting to have sex. Not that I necessarily know that that will happen, but it's such a recurring, I think, narrative um, with like, uh, I mean, even like literature, podcasts, media, wherever, friendships. And I can see how that happens. The dopamine isn't hitting quite so much as it is in the first months. Do you see that happening for men as much?
Yeah, it maybe not as much, but I definitely see desire changes and low desire in men. And I think when men have lower desire than their female partners, there's a lot of shame that
Yeah.
comes up around that. So like, yes, I definitely hear about it more in relationships between men and women with women having lower desire, but it's really hard to unlatch that from societal issues that drive women into these really impossible division of labor situations. So, sometimes it's just hard to tell. It's like if the playing field were really equal, would she want to have sex more? She might. Like, we don't actually know that if she had a second to herself. And sometimes that's a relationship issue, but some of it is also structural and societal. And so even just normalizing that of like we're placed in these impossible roles and positions, and that can be a really big desire killer that can make you not want to have sex.
Well, and sex is pretty inconsistent for women in terms of pleasure, with fewer orgasms and fewer internal orgasms, and it being kind of a physically taxing experience.
Yes, I think it's an old, like Dan Savage, I don't know, comment joke that's basically like if men had to get fucked every single time they wanted to have sex, they wouldn't want to have sex as often.
That's funny.
And I think that's it, right? It's a higher investment activity for the person being penetrated, and I think that's true of any type of penetrative sex. It's just like takes more out of you, requires more cleanup, like comes with some costs and some extra stuff in the way that, like, say, oral sex just doesn't.
Mm-hmm.
And so again, that's coming back to like, well, what if that's on the menu? What if like mutual masturbation is on the menu? Then would that change the answer? If we could let go of the idea like it has to be just this one way, would it change your answer or your availability? Especially if, and often this is the like issue in heterosexual relationships, like if she believed, yes, that actually is okay. That's great. It's awesome. Let's fool around. Let's make out. Let's whatever. There's no pressure. If we took the pressure out of it, then that interest can come back. When there's a sense of pressure, and like my partner is going to be terribly disappointed and maybe sulk or pout, then, I mean, that's like the biggest desire killer ever.
Been there.
Well, but how do you navigate that? Like, I could see, I've been on both sides actually, where there might be a discrepancy in desire, for frequency, or just like when one person initiates, and then the other person doesn't feel like it, that could feel really rejecting, and so that can, like then people don't want to initiate because how do you deal with that where there is that initial like acceptance of rejection feelings around it? Do you just like prescribe a certain number of initiation? Like, how do you work with that with couples?
Yeah, it's a good example of how sex therapy is both like other therapy and also not like other therapy. So like in some ways, this is just like a rejection tolerance thing. Like, yeah, sometimes someone doesn't want to do a thing with you. That's part of being a person. It's part of being in a relationship. If you pout every time your partner doesn't want to play cards or see the same movie as you, like that's not going to go very well either. With sex, it's particularly problematic because with sex, it's particularly problematic because the associations that you make around sex really determine whether you're going to want to have it again. So if now your association is when my partner initiates and I'm kind of on the fence, they throw a little hissy fit. Now we've kind of coded that in to the sexual script, and that's part of it. And again, that's just not a turn on, I think, for anybody.
This is very validating. I mean, it's interesting because when you talk about playing cards, like if I reject sex, it, well, and what you're talking about, it did have something to do with my partner, but like if I reject my current partner for sex, it has basically nothing to do with him and all about me not wanting to play quote unquote cards. Like sex is sometimes hard. I don't always feel like doing it. It's like variably rewarding. But yet it's taken as such a rejection of the self. Like, you don't want to have sex with me. It's about me. Oh my God. I would think some of the work would be unpairing those things. Like,
Yeah.
Sometimes it is about that, right? Because you don't have the same desire, like the same draw to them as when you first started dating, right? So there actually kind of is like a,
yeah, but even when I first started dating him, it's more like I just wanted to be all over him. It's not like I wanted, sorry, the talk. It's not like I wanted to be having sex every single second of the day. I just wanted to be around him and like touch him, yes. But that's an activity that maybe I wanted to do with more frequency back then, but it's I don't know.
Yeah, I mean, certainly there's a place for feedback. And I mean, that's actually the place to start often if there's some sort of challenge happening in a sexual relationship, like, oh, I feel like I'm not as interested anymore, or like one partner feels rejected, is like, how do we make it as fun as possible for everybody involved? Like, how do we make it so satisfying? Start there rather than with how frequent, because not always, but sometimes if you can make sex awesome for everyone involved, it will get them up to their like personal max, their comfortable max of like, you know what, when sex is great, I actually do want to have it once a week. When sex is mediocre, I don't want to have it once a week, because why would I want to do something mediocre on a weekly basis? And when it's, also has, again, that like variability, when there's options for what you do that are lower investment, that don't require, I think particularly for women, like the whole full deal shower and the grooming and the, whatever it is you do to prepare for sex, that can feel very weighty. So like, are there options where you can still be intimate but not feel like you have to do all that?
Are there?
I mean, we do a
There
lot
are.
to ready ourselves for this activity.
Yeah, yeah, we do. It's a burden. It's time consuming, and there is so much cultural baggage, I think, for both men and women, where women feel that they have to be a certain amount of seductive and present a certain way, and then men's value and self-worth is so tied into being able to seduce their partners, that then that's where that rejection comes from, is like, oh, I'm not valuable because like I'm supposed to be able to quote unquote make her want me, when yeah, it might not have anything to do with him. It might be like, oh, I had a bad day, or it might be cycle related, like just like not aligned for me right now. It might be any number of things. It might be, right, like there is a place for this, and this does sometimes come up in sex therapy. It might be like, actually, yeah, you don't do things that are that fun for me, or it seems like you're really focused on getting off and you're not that interested in whether I got off, or whatever it might be. Like that's certainly a relevant thing to bring out. And part of working toward a better sex life is making sure, again, like everyone's having fun.
How do you, like, what kind of techniques are there in sex therapy for, let's say, women who have trouble orgasming? Is that like a common problem, or is that just something that's a holdover from Cosmo?
Well, I think it's so you can look at it having trouble orgasming, period, like at all, ever, under any circumstances, versus having trouble orgasming with a partner, versus having trouble orgasming during penetrative sex.
Hmm.
And so a big part of sex therapy is like education around just, like the likelihood of orgasm during penetrative sex. It's not that high. A lot of women just won't. The clitoris is not inside the vagina, and most women orgasm from direct stimulation of their clitorises. So it makes a lot of sense. And just like aligning people with reality can be a part of this, where it's like, actually, you don't have an orgasm problem. You have like I have a vagina reality. And so like, let's just like align the sex that you have with the anatomy that you have. So I would say that's the more common version, is like expectations around having orgasms without appropriate stimulation. Definitely some people struggle to orgasm at all, or specifically with a partner. They can orgasm on their own, but they can't with a partner. And for both men and women, that can sometimes, or like regardless of anatomy, that can come down sometimes to like the repertoire of masturbation that somebody has come up with. Sometimes people masturbate either with very specific tools, or to very specific content, and it gets like rigid. And so there are like behavioral therapy techniques that you can use to kind of like decouple those stimuli from the sexual response. So that's definitely something that can be done, like redeveloping, resensitizing different types of touch. A kind of classic but still good sex therapy intervention is sensate focus, which is sort of like mindful touch. It's a series of stages in which partners touch each other, not to make the other person feel good, but to just follow your own interest and be really present and mindful and notice, like, what does their skin feel like? Where do I want to go next? And obviously this is within a container of consent. But like, as I'm touching my partner, like this part of their skin feels warm, this part of their skin feels firm, this part of their skin feels soft. That interests me, and following interest in a mindful way, rather than focusing on like, I have to turn them on right now. because that's often where people get stuck when they start having sexual response issues.
Wait, tell us more about that. Wait, so it's not about the person being touched, it's the person touching.
Yes, isn't that so interesting? It's such a different way to think about it. So, one of the like cool things about sex when it works, right, is like it's not really voluntary. Like feeling pleasure isn't something that you can be like, you know what, I want to have an orgasm right now, and 100% of the time I'm going to be able to do it. It's like sleep. You cannot force yourself to go to sleep just like at the drop of a hat. And because it's outside your direct control, trying really hard to do it doesn't work in the same way that lying in bed going like, I have to fall asleep right now. If I don't fall asleep right now, I'm only going to get 6 hours of sleep, and that's not enough for me. I'll be a wreck tomorrow. That doesn't make you fall asleep. And so releasing some of that control over your sexual response and developing interest and sensation is a really useful framework. And we can do this either in a structured way through this like sensate focus style intervention, but it's also just like a way of thinking about sex. Like, how do I be more focused on just like how things feel? What does it feel like? And certainly if you're in a functional healthy state, you can focus on what feels good and following pleasure. But if there's sexual dysfunction, following pleasure sometimes doesn't work because it's like, it's high pressure, right? It creates expectation. Like, okay, so that feels good. Am I going to lose my erection? That feels good. Am I taking too long to have an orgasm? He's going to get bored, right? And so taking away that pressure and expectation and instead entirely focusing on just like mindful awareness of the sensation.
I mean, the amount of chatter going on in people's heads is insane. If I just think from the woman's perspective, I mean, some things I've had in my head are like, you better be really good at sex or he's gonna leave. Being good at sex means being really enthusiastic about sex. So, okay, are you enthusiastic? Well, not really, but okay, like I better act like it. Okay, like now am I seeming like I'm performing? Are these noises I'm making weird? Am I like slutty for having, I don't know, XYZ like desire or this sex at all? Um, what do I look at that from this angle? I've been too long in this position. If I stay in this position for too much longer, does that mean I'm boring at sex? Then we just go back into the circle.
Mm-hmm.
I mean, there's like releasing that, all of that chatter, is a lot. And then for men, I would think the performance anxiety would be quite high.
Mm-hmm.
Um, yeah, so sensate focus is, I mean, that it seems like a mindfulness technique to kind of curtail some of that. Do you do a lot of like cognitive restructuring work as well in sex therapy?
Yeah, I think a lot of what we've been talking about in a way is cognitive restructuring. Like,
Hmm.
sex doesn't have to be penetrative to count. Like, how do we
Yeah.
reframe what that means? How do we reframe the definition of sex? Like, a classic sex therapy intake question that anybody listening can ask themselves is like, what is my definition of sex? What does sex mean to me? And you can talk to your partner about that. Like, how do we as a couple define sex? And if our sex life is healthy, what does that mean? What does it look like when we have a healthy sex life? Because these are not just like simple, there's one answer questions. So yeah, I think cognitive restructuring is a huge part of it. Practicing behavioral skills. Sometimes people got really bad sex education, and so like they're not great at certain sex skills, right? Like, or they have incorrect anatomical awareness, especially I think for men partnered with women, sometimes they've just received a lot of garbage about like what women are supposed to like, and then paired with a woman who might have received a lot of garbage about like, oh, I'm not supposed to be that demanding. I don't really like that, but he seems to like it. So I guess we'll do it. That's something he likes. I've definitely talked to people who've had long relationships where something was happening in their sex life and it turns out neither of them liked it. And they both thought that they were doing it for the other person.
Like
What
what?
is
I mean, you're just
What?
taking me back to all my 20s. But
Like mundane, I mean, it can be mundane. It doesn't have to be totally salacious, right? Like, oh, like I think he really likes kissing my neck. It must be a turn on for him, but actually it's so ticklish for me. I don't prefer it. And they just haven't brought it up. And much more commonly, let's see, the most common kind of unfortunate thing that happens is that, in heterosexual relationships, women have something they really want or need out of their sex life in order to make it good for them, and they just don't feel empowered to ask.
what is the role of fantasy? I could see how I mean, it could enhance orgasm, but I could also see and like enhance the experience, add fun and play, but I could also see how it would separate the partners so that they're
Mm-hmm.
both kind of in different worlds.
Yeah, I think, a lot of people can sort of lightly slip in and out of fantasy in a way that's very functional. And so if that's you, if you have moments during sex where you kind of like go away into imagery or somewhere else, I don't think there's anything problematic about that at all. Fantasy where you really, in order to experience pleasure, need to mentally go elsewhere, need to really picture something else, can be an intimacy killer, right? Like if your partner, in order to orgasm, always has to go completely silent for 10 minutes and, their body isn't moving and stuff and they're picturing something in their head, that can be a little alarming, and just feel more disconnected. So I think it's a balance. I don't think, and again, this isn't one of those like right, wrong things. This is how does it feel for everybody involved. I can see a framing of like how incredibly intimate that you feel comfortable being in the presence of your partner, but going wherever you need to go, like going to the most, intimate parts of your fantasies with them right there. Like that's actually kind of hot, right? And I can also see it as like, they left me behind. They're not here anymore. They're just off in their own thing and I'm just a body. So it really is going to depend on the two people and how they feel about it.
What do you do in that? Well, let's say that was there's a problem there. Like let's say they're the partner who is like kind of feeling on the out when their partner fantasizes, but that's what they need to get off, or
Mm-hmm.
that's what they like. How do you change? Like who changes? Who has to do the work to come together? What do you do?
Yeah, it's such a good, like, this is how therapy always is, couples therapy in particular, where it's like everyone changes and also everyone doesn't change, kind of such a both and. So in a case like that, then, we would want to get clear about what feels unsettling and what the problem is, right? Like, okay, I feel really abandoned when you're silent for long periods of time during sex. And I know that you're fantasizing about things that are outside of the two of us. That feels, really kind of like violating to me in a way that sometimes people feel about that. And the other person's like, yeah, I get it, but like that's how I have an orgasm. I don't know how to have an orgasm a different way. So we might do a bunch of things. We might try to address that, like having an orgasm in multiple situations. There might be some like inflexibility there. And often people, this goes back to how they like learned how to masturbate and just like did it over and over again in the exact same way, reading the same story or watching the same porn or touching themselves the same way, picturing the same thing over and over again for like decades. And there can be retraining around that, right? Like it's not like retraining who you're attracted to, but just sort of like, do I have to always picture this one scenario every single time? So that's certainly an option on the table. Another option is that maybe during certain types of sex, they negotiate out like, hey, I want us to be connected. Can you stay with me? And then afterward, like, I'll participate in helping you have an orgasm and you can go where you need to go, like working out, like when do I really need you here with me and when do I not need you here with me? Helping the person who feels abandoned maybe rethink what it means. Does it have to mean that they're abandoned? So there's like a multi-prong approach.
Have you gained any insight onto why rape fantasies are so prevalent with women? Just random little insertion.
Yeah, they're so prevalent. And it's interesting because I find like most women wouldn't put it that way, but we do know that it's like the most common fantasy.
It is.
I Yeah, yeah, it is. So rape fantasies are like consensual non-consent or forced seduction. There's all these different ways to call it because I think understandably, like we want to be thoughtful about how we talk about fantasies that are not actual sexual assault, right? Because the fantasy is not, I actually want to experience a sexual assault. It's, I want to experience knowing that I consented to something, but like playing with this taboo, this idea of forced sex again, in this completely consensual container. Even if it's a fantasy and you're fantasizing like, oh, but what if it really happened? It's still a completely consensual container. Like the nature of the fact that you're fantasizing about it makes it consensual, with the exception of, and I wouldn't categorize this in like the rape fantasy bucket, for trauma survivors who sometimes have like intrusive images coming up of their actual assaults or of similar events. Kind of like a different, more like obsessive thought loop type thing. But for somebody who just like the way that they masturbate is like they find it really sexy to think about, like, what if I was just taken? There's whole genres of romance devoted to this. It's a very popular trope and idea to play with. The like historical answer that I think has some truth to it is that, women didn't have historically a way to claim their own desire. Like you couldn't just be like, I'm horny, I want to have sex, I like sex. And so fantasizing about having sex taken from you was a way to access like wanting sex. So that's kind of one of the like classic explanations. Something I think that is prevalent kind of in today's world is like women have a lot on their plates, are doing a lot. And so the idea of just like complete surrender to something similar to, interest in submission can have an appeal. Sometimes it's like, oh, I watched this one movie when I was 12 and it just really stuck with me. And now it's in my head and it's part of my arousal patterns. Like sometimes there's not a logical reason.
It's pretty much aligned with my independent hypothesizing, which is just that like women have to, so much goes into, asking for sex or having sex. Like, will my number go up too much? Will this guy call me again? What will my mother think? What will my future husband think? Like, and if you can just erase all of that negotiation, then what a relief. And that's truly sexy. Like to not have to think so much. Wind yourself into a knot trying to figure out if you should even want the sex or if wanting the sex is enough of a reason to have the sex. That's all such a sexiness killer.
Yeah, all of that like worry tends to be a sexiness killer in the same way that for penis havers, like thinking about like, am I going to be like the best lover ever? Am I going to, like really take her to the moon with my equipment here? That is also a huge boner killer, right? Like that's one of the main interventions around erectile dysfunction is just sort of like, it's not that big a deal. Like your penis might get flaccid. That's something that happens.
Yeah.
What about if there's like a fantasy, for example, the rape fantasy or something else, where it brings up a lot of shame, or it's like, this is my fetish or kink or whatever, but my partner is upset by it, or I find it disturbing. Like, can people retrain into other kinds of fantasies or adjacent activities, or is it kind of like more about acceptance and leaning into something like that?
Yeah, so it's sort of like with anything, any mental health issue where someone else being distressed about your symptoms is never going to be like quite enough of a reason to have the symptoms be a problem. If you're like completely fine and there's no functional impairment, the fact that your partner is like, yeah, but I really don't like this about you is not a reason for it to be a problem, for it to be like a diagnosis if we were talking about a mental health issue. And that's often how I see people navigating these sorts of things where it's like, well, what does it mean about you that you want this? I would generally place that on that person asking the question. Like, what does it mean to you? And, like what happens for you when you think of your partner having that attraction? And, how can we reconnect and accept the fact that they have that attraction? That's assuming obviously that they're doing like legal and consensual things that are within the container of whatever like monogamy agreements a couple has. So I think sometimes this topic is just like very, very triggering for people who have a history of infidelity in their relationships, because it's like, well, yeah, it matters what they're into because they're going to go have that type of sex on the side. And so like I'm putting a caveat out here that like I'm saying that within a monogamous relationship, as long as what your partner is doing is a fantasy, that they're not violating your relationship agreements, I personally take the stance that it's not your job to tell them like, ew, that's icky. Of course, you could decide you don't want to be with somebody who has certain types of sexual interests, but the reality is you're not ever going to know for sure that you know all of your partner's sexual interests. And what you teach your partner when you have a huge disgusted reaction, when they say like, oh, I'm actually really into this, is like, don't tell me that in future. That's icky. I don't want to know. You teach them to lie to you.
I guess how I don't. This is a half-baked question, but like, how much do you find that kink really centers itself in a relationship? I mean, if somebody has a dominance fantasy that's, I guess it's just a degrees question, but I guess like, can it work if you've got this kink and your partner doesn't like it? Like, is it worth
Mm-hmm.
finding a different relationship? And I mean, I guess I would assume that depends on how important that kink is to you, but it also seems to be like a degree of kink is a little bit out of your control. So I
Yeah.
don't know how that works.
Yeah. I mean, I think you're right on in that, like, the degree is going to be the big linchpin here. I do think in part this is sometimes why people explore non-monogamy, because it's like, oh, actually, I don't want to end this relationship, but my partner does have an interest that I'm not interested in participating in, like in any way, shape, or form. I do sometimes see people get good success with like, okay, I don't want to do that, but like I'll talk about it with you. We can pretend we're doing it. We can talk about doing it. We're not going to do it, but like I'll talk to you about it. And that's the destigmatization part, that just knowing like my partner doesn't think I'm icky. They are accepting of me. That's not their thing, but they're willing to play. That can be a huge game changer. That's not going to be the case for everybody. You can't like be playful about something that truly you have like a very distressed, triggered reaction to. So that it might not be available, but sometimes that's enough. Sometimes that takes the edge off of like, okay, I don't get to actually do this thing, but we get to talk about it. We can even like incorporate it into our sex life without doing it, talk about doing it, but not doing it. That might be enough. Opening up the relationship is an option. And then, yeah, for some people, that might be a deal breaker.
How would you suggest couples who are not in sex therapy to ask each other for something like this? Like what you just said before stuck in my mind, that women have a really hard time asking for what they want. And I think men too, in different ways. But if there's like, oh, I want to explore this new thing, or I want to explore a fantasy, and it's especially if people are in a long-term relationship, or, how do you just bringing it up in the moment might be tough, but how do you
Yeah.
sit down and say, "Hey, hubby, what you know what I really want to do?" Like, how do you do that?
Totally. Yeah. So a few things I think can help with that. One is, although you certainly have a right to make sexual complaints, and if you truly have them, you probably should make them. If there's things that could be shifted without complaining, it's probably best to focus on what you want rather than being like, what disgusts me is when you kiss me like that. It's just the worst feeling and it reminds me of my uncle. Like, like he has a beard and your beard is scratchy and, like whatever. Like you're describing it that way is going to shut them down, make them feel so ashamed. And so being able to, whenever you can, again, this isn't always possible, like make it fun, make it sexy. Like, what I love is when you do XYZ, like when you kiss me really softly, that feels so good. That's my favorite. What is the one question I really like for couples after sex, like right after having some sort of sexual encounter, is asking like, what was your favorite part? And then it'll cue your partner to reciprocate that question, like, oh, what was your favorite part? And you can say like, oh, when you did XYZ. So if they're already doing it, this is very behaviorist of me, like if they're already doing it, reinforce that they're already doing it, right? Like praise it in the moment, show that you're into it. If it's something that they haven't yet done, but you want them to do, I think, you have a lot of options. You can bring it up, kind of like before sex as part of a bit of like a flirty conversation. You can do it in a text if it's something that you don't think is going to be like shocking to them. If it's a big ticket item that you've never approached, maybe don't do it that way. But if it's something that's on the menu already, like, it would be super fun tonight is if you XYZ'd. So finding ways to make it a little bit lighter and less like, I have some critical feedback for you. Are you ready? Because that tends to turn people off and make them feel like they did something wrong, rather than just like, hey, we're just like going back and forth and chatting about things.
I wonder, so I had this experience for the longest time of men being like, tell me what you want, tell me what you like. And I didn't know. I mean,
Mhm.
some things I maybe knew, but in other ways I was like, I don't know. I've never really analyzed how somebody's gone down on me and thought like, okay, this is the thing that I like and that's the thing I don't like. And then I think there's probably some, I don't know, just part of me is a little bit like shut down to understanding exactly what I want and like. And how do you deal with that?
Totally. Well, yeah, I think that's really common. That's how a lot of couples try to talk about sex is like, hey, do you have any fantasies? And the other person's like, no. And then that's it. It's kind of like the end of the conversation. If you Google yes, no, maybe lists, there's tons of these that are just like free and everywhere. And they are sort of what it sounds like lists where you can check off like yes, no, maybe
Hmm.
to different activities and then compare them. And that's a really great, like, external thing that you can look at and be like, do I or do I not like that? And sometimes seeing the option helps you know the answer versus having to come up with it and generate it yourself. So that's a fun tool. I feel like that's a fun kind of like sexual date night to do together and then talk about. You don't even have to have sex. That's something that I always encourage is like just talking about your sex life in a positive way is your sex life. That's part of your sex life, the dialogue you have about it. It's not separate from it. So that's one way I think that people can get more in tune with what they like and don't like. I think, if you're working toward that mindful self-awareness of sensation, like going toward interest in the moment and then like reinforcing it live of like, oh, like, I like a lighter touch. That feels really good. Or like I really don't like a lighter touch. It gives me like the heebie-jeebies when it touches me really lightly. Moving, if you have like easy consensual relationship where this is comfortable, like moving your partner to like press just a little bit firmer, not necessarily the kind of like dreaded like blowjob head press, but like if you want them to be a little bit more firmer, like pressing firmly on their skin so that they can feel that sensation. Like there's some subtle reinforcements that you can use. Dirty talk, right? Like harder, like, whatever. So that's how you communicate the interest. But yeah, I think that like fantasy, reading, these are ways to figure out like what you're into. I also don't think there's like an answer. Sometimes when people don't have one particular kink or they're not like identified with a particular type of sex, it's like, am I supposed to have some sort of like complex answer to what I'm into sexually? And it might be like, I don't know, I like sex, I like kissing and like these 7 sexual activities, and that's about it. And that's fine.
I've never actually heard someone talk so much about the retraining piece and like learn, and so I'm still puzzling over that and wondering in this kind of scenario, is it like people have their things that they like and then it's like relatively fixed, or how flexible can you get in terms of what you like? Like if someone asked me that, I'm thinking about like, okay, there's certain things that have always liked, but then some things have changed over time. And now I'm thinking like, how malleable are people's like preferences?
Mm-hmm. Yeah, and when I think about retraining, I think about it less in terms of like preferences and more in terms of flexibility, right? So it's not like I'm no longer gonna like that thing. It's
Right.
that like, is it possible for me to like other things too? And I think that can be helpful. It's not like I'm trying to change you framework. It's like we're trying to expand the number of things you can do only if it's disturbing to that person, right? Like if I'm perfectly fine with my one way that I can have an orgasm and it like requires 3 pillows and like, a massage wand from the 90s, like fine, that's fine. You don't have to have an orgasm any different ways. But like if that's not doing it for you, if it's causing problems for you, then like being able to gradually lighten up the intensity of that sensation, gradually like make the pillows less fluffy, like that is an option. Women are a little bit more sexually flexible, but it's hard to say if that's like, I don't at all have the answer to this. Like, is it biological versus like, are women given more space for sexual expression and there's less baggage about like, that means like for men, I think there's so much of like, that means I'm not a man or like, that means I'm gay if I like XYZ. And so women, generally speaking, do have a little bit more sexual flexibility. And that's something that we see, but yeah, I don't think of it as like changing your preferences. I think of it as expanding what works for you.
Speaking of gay, I just read the book The Tragedy of Heterosexuality by this lesbian sociologist, and it was like it was extremely validating to read this book. And the premise of it, I mean, I'm going to be very reductionist here, is why do men and women seem to hate each other and
Hmm.
yet date each other?
Hmm.
Where, I mean, so many of their interactions are unpleasant, creepy. A lot of women saying things like men are trash, women having to like, tweeze every single hair on their bodies just to be like prepared for sex. And she was comparing this to queer sex, where it's like many more body types are considered sexy. Maybe different kinds of intimacy are considered sexy. There's a lot more like play and flexibility. And I don't know if this has more to do with there's been less like of a societal consistent messaging around what kind of sex is okay. But I don't know, do you see significant differences with your queer clients around sex? Or do you see things that come up for them? Or do you see things that maybe heterosexual people could like take from them?
Definitely that. I mean, queer couples have desire discrepancies, have sexual, differences in terms of interest. Like it's definitely not like a panacea for all sexual ills. There is really interesting research that kind of goes with what you just said, that women in relationships with other women who have vaginal pain, that's like diagnosed as vaginal pain, do not experience it as problematic because there's no pressure for intercourse. And so it's like, great, I don't have to do the thing that hurts. So it's not distressing to me that I have this pelvic pain versus women in heterosexual relationships who have pelvic pain. It's distressing because they are trying to have intercourse and the intercourse then hurts. And of course, there are things you can do for pain during intercourse and the ways to improve that and hopefully resolve it. But I've stuck on that as just so interesting that like, how positive to be able to have this thing where it's like, oh yeah, I do have this thing with my body, but actually it's not a problem at all because we can just completely work our sex around my body and the way that it functions. So that's, I think, an example of something that like heterosexual couples really could take from queer couples as like, can we just like work with what we've got? Can we like work with what we've got on a given day in terms of interest, in terms of bodies? I think that is much more common in queer relationships.
So interesting. This whole conversation is making me think about how much we go into sex with such like blinders on, with very specific expectations and like beliefs around, can I do this? Can I last this long? Am I this big? Is my vagina like that? Blah blah blah. And then it's really more about like exploration and understanding the realm of possibility.
Yeah. Well, that comment really begs a whole other conversation about the role of porn, but that might be a bigger can of worms.
Please,
I don't know.
no, please tell us that because yeah, let's dig into that. Is that how can porn be helpful or harmful if in your
Yeah.
practice have you seen?
Yeah, I mean, I'm like porn neutral, and I try to be really clear about where I'm coming from around porn, both like on social media and also with clients, because some people have very, very strong stances, and I just always want people to like know what they're getting. So I'm porn neutral, which is like porn exists. Porn is a thing that is in the world. There are forms of porn that are more ethically made, and if the ethics of your porn are concerned, like those are options. People use porn. Like I'm kind of just straight down the middle. Like it's a substance basically. It's a material that is available, and people are going to use it in a lot of ways. I do not take the stance that porn is cheating, which can sometimes anger people on the internet. And just say that out front in case you're listening and you're like, what does she think about that? I'll tell you what I think about that. I really believe in people's like right to private sexual expression, and that you know what turns you on and how you masturbate, as long as it doesn't involve like another human being sort of like live with you, that's up to you. So I'm not down to help people tell their partners they're not allowed to use porn. However, I do recognize there are some concerns that can come up around partners' porn use that are very relevant to the relationship and are things that I work with. So yeah, porn can be just, whatever. For people, it can be something like, oh yeah, when I want a quick orgasm, it's something I look at. It has nothing to do with our sex life. We have as much sex as we want to have. It can set up really unrealistic expectations about sex. That's a thing, right? Like it can do that. I don't think it has to necessarily, but it can. And I've definitely seen that happen where expectations about what types of sex acts are just kind of like gradually getting more and more intense. And in couples that don't have an agreement about like, oh yeah, we're interested in kink, that there's this just like intensification of like everyday sex. The vanilla sex is getting less vanilla, basically, related to porn consumption is something that I've kind of observed, which maybe isn't a problem. Like maybe for some couples, it's like, great, we're learning new things. But if your partner is sort of subtly being influenced by porn and expecting things from you that are not your desire, that can be a problem. I do think, just from a like physiological standpoint, if somebody has a more compulsive relationship around porn, especially as guys get older, they may have difficulty bringing sexual energy to their partner if they are masturbating a lot. Period. Often it's paired with porn, but I guess it isn't necessarily paired with porn. But if you're masturbating twice a day, like as guys age, they're just going to have a difficult time bringing any sexual energy to their relationship. Like the semen is gone because it's been spent elsewhere. So that can come up as an issue. I mean, it's so nuanced and like complicated to talk about. But yeah, my stance on porn is kind of like, it exists and we have to grapple with it. And some couples can use it within their sexual relationship in a really pleasing way. And others, that doesn't work for.
Yeah, I'm very like generally pro porn, but I have seen in my sad 20 dating life where you're hooking up with someone and you're like, you got this move from porn. Like I don't think, I could be wrong, but I don't think women like what you're doing. It's just like you're just like trying to buff out a scratch on your car is not like this is not something, or we're in a position that we're aiming to be visible to some like imaginary camera. I mean, this is not working.
I
worried
did
about that.
various practicum at college counseling centers in my postdoc too, and so I got lots of like bad hookup story content in sessions, and definitely that I think especially for more casual sexual encounters where you don't have that context of like, hey, actually I don't like that, like don't do that, where that might be harder to say, that sort of like pornification of daily life. Like, yeah, I think it's a thing. I don't know that I would go so far as to say I'm like pro porn, but I'm not anti-porn either. I'm porn neutral.
I'm kind of anti-porn, so we've got the spectrum. I mean, I'm not like wholly, I just wish all porn were directed by women, I guess.
Yeah.
Because I wonder, if beyond the expectations for like particular sex acts, there's also, so I don't watch porn, but I'll take a gander occasionally. And it's just, and by a gander, I mean, I don't do any deep dives or anything like that. It'll be like, what's on Pornhub, right? What are the trends these days? And the one common denominator is all the shit that the tragedy of heterosexuality is talking about, like really debasing women and really gnarly relationships between the man and the woman in the scene, and then terrible sex. So I don't know. I don't have a problem.
That's a bummer.
But...
I mean, that's directed by women is a great option. Paying for it, that this is when there's a difference. Say I was working with a couple who, one partner uses porn and the other partner is really uncomfortable with it. Often where we might end up, at least as an option, is like, let's start paying for porn. Let's stop, like whatever comes up on Pornhub is what I consume. Like, let's start being purposeful about like what I invite into my sexual fantasies, because there's just much better quality porn if you pay for it, which makes sense because you can make a better quality product if you got paid for it more directly. And then there's some modern like porn/sexual education platforms that I've seen couples use and enjoy. Like there's one called OMG Yes, that is like both sex education and also has videos. And so, is really different framework. So I think that can be a nice compromise if there's a difference around expectations about porn. Like, I'm not going to watch porn where we're worried, like, was this person exploited? Where we're really concerned about kind of the messages that the porn is sending. Although certainly, I don't ascribe to the idea that like there could be very feminist porn that looks on the surface debasing to women, because maybe that's just the interest that they're catering to. Yeah, right, exactly. So, I don't think that all feminist porn, actually, this was a really interesting thing. I taught human sexuality when I was in grad school, and I showed porn clips in the class, which is an interesting thing. And I didn't ask permission from like the school. I just kind of did it. and it worked out. And so, I sourced all these different types of porn clips, and part of the exercise was like, what is feminist porn? If we're watching pornography and assessing it for being feminist, like, what does that even mean? And one of the things that students kind of consistently came up with was, the focus on like consent and the visible pleasure was really important, not necessarily what the clip was like. And so I showed clips that were more like romantic, and often initially people would be like, well, I thought that would be the feminist porn, but like it's not necessarily, just because it's like soft and romantic and like a little squishier feeling. It could be hardcore like BDSM porn, and it could still be really overtly feminist, depending on how those sex acts are framed and set up, and how the consent is shown, and like what's happening with the power dynamic, like can still be really feminist pornography.
Yeah. I mean, I think part of what I object to is just that the girl is always kind of portrayed as like stupid, like dumb, and I don't, whatever. Any of this can happen in feminist pornography too, but anyway. And I'm also worried about like the younger generation, and they are not going to pay for porn, and so they're going to consume whatever is at the top of Pornhub, and I'm concerned for society, but maybe that'll be for the next generation of therapists to work through. I don't know.
Maybe there'll be a movement of like, pay for your kids' porn.
Yeah, I think the only question I had left was, like, what do you do when there has been a history of sexual assault that is impacting the sex life of your patients?
Yeah, and that's something that often people are dealing with, both like in their individual therapy and then also in their couples therapy. And so, on the individual level, it's like trauma treatment to address that trauma. On the couples level, I think, you can bring the partner in to just really understanding why certain things might not be available, helping them, have more compassion and understanding, because sometimes it might seem kind of idiosyncratic. It's like, why would me, like, I'm a safe person, why would me, like, brushing up against your shoulder be so distressing for you? And people can personalize that. So education to the partner of kind of like how trauma symptoms develop and how they work, that it's really not personal. Sometimes one person will, the person who's experienced a sexual assault, like they really want to take back more of their sexual activities. They don't want to be sort of like letting trauma triggers decide for them what sex acts they participate in. And so then there can be kind of like coping strategies for like, okay, you might experience, a trigger. You might experience, some sensation during sex. Like, what's the plan when that happens? There's a really nice older book by Wendy Maltz. It's called The Sexual Healing Journey. That's wrong. Let's see what it's called. The Sexual Healing Journey. That has a lot of like really nice exercises and like a very sort of practical approach to dealing with triggers that come up during sex, and like kind of healing sexually, both individually and as a couple. So that's like a very widely available on Amazon option. It's a really challenging thing. I recently answered kind of this question in my newsletter, and the question writer posed it as like, my boyfriend keeps doing something that he knows I don't like due to my sexual assault history, but he has ADHD and is really impulsive, and he keeps doing it during sex. And I thought it was such an interesting question, and I really thought a lot about it because, especially with the written word and without an actual couple in front of me, I know that people are likely to kind of polarize and be like, well, that's a deal breaker. Like that's violating consent. That's, sexual assault on its own. Like you should break up with him. Or like, well, he has ADHD. He can't help it. And like, you need to be compassionate to him. We're really tempted to polarize and see this in a very black and white way. And kind of where I came down to with that particular thing, which isn't exactly what you asked, but I just think is interesting, was that there's like appropriate boundaries that need to be set, right? Like if someone keeps violating your boundaries, then you need to decide like, what am I going to do? Am I going to continue to be sexually available knowing that this might happen again? Am I going to limit my sexual availability? Am I going to ask for certain steps to ensure that this can't happen again? It really made me think, especially thinking through, well, does it matter what the sex act is? I pretended that it was kissing the person's neck, but what if it wasn't that, right? Like, what if it was a more intimate sex act? That would probably change the answer too.
I did think of one more question, but
Okay.
Gibby, I don't want to steal it, Mike.
Yeah, go for it.
Okay, my last question is, you work with high conflict couples. And a lot of people in those relationships describe the roller coaster. And the roller coaster is bad, but it's also good because at the top of the roller coaster, it's really fun and passionate. And maybe in that passion can be a reason why you stay in it. And I would think that has all sorts of implications for sex and maybe a misuse of sex. Like after fighting, the sex is really great. And maybe that can encourage fighting. Any kind of notes on that
Yeah.
dynamic?
Yeah, sometimes when I post about the intersection between high conflict and sexuality, people be like, there's no way these types of couples are having sex. And of course, some high conflict couples don't, but a lot do. And it is exactly what you're describing quite often, where there is that roller coaster and makeup sex is a really big ritual. And it's like, okay, we know we're okay. But that does tend to reinforce the like toxicity and the ups and downs. And so I, kind of like tend to recommend delaying makeup sex. Like don't fall into bed, right? As you're, okay, we made up, now we get to have this, because that really reinforces like, this is what we get after we're horrible to each other. Make sure you fully close the loop. Make sure you actually properly resolve the conflict. What people often do with makeup sex is like, they resolve it just enough to start making out. And then afterward, it's like everyone has good, happy hormones and they're no longer in the mood to keep fighting. So they just move on, which can be fine once in a while, but if that's your main conflict resolution strategy, it's really not going to work. So, sex is awesome, but it's not a good, like, perpetual conflict resolution strategy if it means that you're actually avoiding the problems that you're fighting about.
Great. Do you, where can people find you if they want to, get more resources, or even, are you taking new clients or?
I'm typically full. Something I'm starting to do a little bit more often is in-person intensives in Portland, Oregon. So in general, my caseload is full for ongoing clients. But if people either are in Oregon or have the ability to travel to Portland, which is a fun city, that's a way to work with me if that's something you're interested in. And that information is on my website. And then you can reach me for just like general commentary on relationship complexity on both Instagram and TikTok at Dr. Marina Rosenthal. If you click to either of those places, you'll see a link and it will lead you to various resources that you can check out, some of which are free, my blog, various ways that you can hear more from me.
Awesome. I do recommend you check Marina out on Instagram at Dr. Marina Rosenthal. I do not tend to follow a lot of psych accounts. They irritate me, but I do like yours. And you do address
Really good.
complexity in a lot of different ways. And I really appreciate that because that's difficult to do in a 90-second clip.
Thank you. That's nice praise.
Well, we will see you all next week. This was a really gratifying topic to have an expert on because it's usually just Kibby and me talking about our own experiences or hypothesized experiences. So thank you for giving us some legitimacy for this. And thank you for coming on for a second time. Maybe we'll see you again. But for now,
I would love it. Thank you for having me.
Thank you everyone for listening, and we'll see you next week. By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval or endorsement.